Good morning, good afternoon, good evening, wherever you are in the world. Thank you so much for joining in. This is the Unboxing AI webinar series number nine, episode number nine today. Uh, we are joined today by uh, our friend, our soon to be couple user, Dr. Melissa Davis. Uh, Before we dive into Melissa's background and get her thoughts on some things, for those of you who do not know, CARPL is an enterprise imaging AI platform. We are called an AI marketplace. We are called an app store for AI. We have also been called an ML ops platform. But essentially, we sit between an ecosystem of AI developers, whether commercial, whether in-house, open source, what have you, and radiologists, essentially allowing radiologists to access the encapsulated value of the entire AI ecosystem on one side. So yeah, so without further ado, Melissa, thank you so much for joining us today.
Yeah, thank you for
It's
having me.
it's an honor.
Thank you.
I will start by a brief introduction of Melissa. Our team has put together something. So, Dr. Melissa Davis completed her BA in chemistry and psychology at the Wellesley College in Massachusetts. In 2009, she received her medical degree from the Medical University of South Carolina in Charleston. Subsequently, she completed her diagnostic radiology residency and a neuroradiology fellowship at UNC Chapel Hill. Uh, Dr. Davis obtained her MBA also in 2017 from Yale with a focus on healthcare management. And she's currently an associate professor of radiology and vice chair of informatics at Yale in the Department of Radiology and Biomedical Engineering. Uh, since completing her MBA, she's focused her professional and academic areas of interest in organizational change and innovation within the healthcare space. I'm sure we'll go deeper into that as we chat today. As a physician, her core objective is to serve the needs of the patient. To wholly serve the patient requires, as many of us know, more than uh, the interaction at the point of care, but rather creating and functioning within a system that is built to support the patient and providers. This has driven the focus in her career on operational workflows and improving quality within the inpatient and ambulatory spaces through innovative approaches and new technologies. Thank you, Melissa, for joining us today.
Thank you for having
Uh,
me.
you know, Melissa, as I had mentioned, we typically start with asking you what you do, but with a caveat that tell us what you do as if you were telling a 5-year-old.
Yeah. So I actually had the
And we want to
opportunity.
know informatics and radiology both, and not
Okay.
just.
All
Uh,
right. Good. One of my aunts actually teaches a 5-year-old class, and I was at her class a couple of months ago telling them what I
wow.
do. So I think that this is a good question. Have a little bit of prep here, I guess. But I'm a radiologist, as Vidya was talking about, and basically what I do is I look at pictures all day, and I tell people what's on those pictures. And so one of the things about being a radiologist is that we get to diagnose things. I'm an emergency imager specifically. So if you come into the ER and they do an X-ray, a CT, or some sort of imaging study on you, I'm the person who reads those studies and tells them what's going on from an imaging perspective. So the core of my job is looking at pictures all day long, and it's part of the reason why I got into it. I love images, and pictures and painting and art and all those kinds of things. So it fits well into my personality. So that's like the radiology side. And then from the informatics side, I think it's a little harder to explain this as a 5-year-old, but from the informatics side, I really help with putting together the way that we work in our radiology department at Yale. So radiology, everything uses a computer, everything is IT based. And so it's how do we put those things together so that they function well for our radiologists, for our patients, for our staff. And so most of my work is understanding how to connect the dots from the different systems that we have, and then looking for other things that may help us along the way.
Nice. That is pretty interesting. In fact, Melissa, do you see, like, this is a bit of a sidetrack, but do you see a lot of radiologists interested in art? Like, do you see that correlation, or do you see like some radiologists not wanting to see art because they've had enough images during the day that they're like,
Yeah, I mean,
do you
ironically,
notice that trend anyway?
I think there might be a bit of a trend there. Most of my radiology friends like art in some way. A lot of them are photographers or painters, and do a little bit of that on their own, like just as a hobby. But yeah, I think that there has to be some draw there, some part of the brain around art and pictures that's very similar. I was at an art opening not too long ago, and they were doing 3D anatomy images, essentially, and that was really interesting. So I think that all of us have a bit of a lens towards art and images in general.
Yeah, I think essentially your like a radiologist profession is picking out extremely small differences in images, right? Like, uh,
Yeah,
what's the
it's almost
difference
like
between
where's
a
Waldo?
normal and an abnormal?
Yeah, I don't know
Yes,
if you're
exactly.
familiar
It
with
is. It
Waldo,
is.
but it's very much like that. And
No, maybe
one
maybe for folks on who are attending, they may not know. Could you tell us what that is?
Where's Waldo? Yeah, I mean, it's something that was really popular when I was a kid. I don't know if it's around too much anymore, but basically it's like, a busy image and you got to go find this one guy in the image,
Hmm.
or basically. And so there'd be books on this where you would, and I would spend hours in these books where you just would see like a million people at a clown show or at a park or at a fair or something like that. And then Waldo would be very small and you have to go find him, and identify where he was. And some of my radiology residency interviews, they asked me to pick out where Waldo was in the
Oh,
book.
really? Wow.
I thought it was a myth, but then it happened. But luckily, I'd already seen those pictures 1,000 times, so I knew exactly where he was. So,
Shucks, I think that is a cool caption for this
yeah,
webinar. Where's Waldo is real.
yeah, exactly, exactly.
Wow. No, oh, that is pretty cool. So, Melissa, tell us about your journey, right? Like from studying chemistry and psychology to medicine to neuroradiology to informatics, like uh, and all in a, like, if I may say so, I think your career progression has been, that would, like, extremely fast. So, how does that happen? Like, what were your motivations? What were you thinking as you were doing this? Was it, um, yeah, I would love to hear your story.
Yeah, I mean, I'm from the southern aspect of the United States, and so I decided to go to school at Wellesley, like you mentioned. And my goal there was really just to be like a chemical engineer. That was what I actually wanted to do. But I quickly realized that I didn't have the brain power for it. So I struggled in those leader classes, so I decided to kind of fail
So,
on that.
so you decided to be a doctor.
Yeah, exactly. But I went to Ghana for a summer, and I worked in a midwifery clinic, and I just
Wow.
really enjoyed that type of interaction, and wanted to be, more useful. That's what I came out of that experience of, like, wanting to be more useful, and that was really the impetus for me to go to medical school. And the first couple of years of medical school, you're just kind of in classrooms and things like that. But I did get connected with a radiologist. I had no idea what a radiologist was at that point. Had never met one, or anything like that, but they were really nice and they were very relaxed people. And I enjoyed sitting in the reading room, and they just fit my personality. And so I decided to try and pursue it going forward. And, even now I say that my path is not what I thought it would be. I thought I'd be in a private practice, probably, just, doing the private practice thing. I think I would have been very happy with that. But I decided to go get a business degree, because when I was in residency, a lot of time when we had frustrations, I realized that the people who were making the decisions had some sort of business background, or maybe they weren't physicians, maybe they were non-physicians, making these decisions, but they had an MBA. And so I wanted to be able to make decisions too, and to talk to the people who are making the decisions, and see what, and just not feel like I had to do something just because I was told, but because there was some sort of decision making behind it. So I decided to go for the MBA. And I got into this really great program. At Yale, we have a program where if you're a radiologist, you can work in the emergency section, but also go to the executive MBA course. And it's
Oh,
a way to kind of do it as a fellowship. So it was really a second fellowship, that we were doing. And we've actually started another one very similar to it, where you go get a public health degree and you work for the radiology department, but it's centered in informatics. So we're pushing forward on that as well. So I did it with the business lens, and that really got me into AI and into tech and into the startup culture and all that kind of stuff. So a lot of the people in my class were engineers, and a lot of them had their own businesses that they were starting. And I joined a couple of ventures along the way. And got just more and more exposed, and really, really liked that side of things. So, I've tried to push my career in that direction going forward. So I don't really have any formal training in AI or formal training in informatics. It's all been a learning process for me, as I get more and more exposure over time.
nice. And so, uh, on the MBA front, like, again, I am also a physician who's done an MBA, but mine was like a full-time version. And of course, I don't practice, but you were practicing while studying. Is that something you feel like folks should generally try to do as the world is progressing today, or do you think like it's uh like how does a radiologist, who's say confused about whether to do an MBA or not, like what is a framework they should use to figure out whether it's something worth pursuing?
Yeah, I think it's helpful for some people and maybe not for others. So I think it just really depends on what you want to do with it. I mean, you said you did an MBA. You kind of know what the content is. It's not really it's not rocket science. A lot of us can
Correct.
pick it up. It's accounting, it's statistics, it's leadership stuff. A lot of this is kind of out there, to be picked up if you don't want a formal degree. But for me, I thought it was useful if you didn't want to keep doing what you're doing. So, like if you're a physician
Mm.
practicing and you want to shift, it's a useful way to really open up the world and have exposure to other people, maybe within healthcare, who maybe aren't physicians. Maybe they're IT, maybe they're on the engineering side, maybe they're administrative, maybe they're in startup, maybe they're doing something completely different. And I didn't have that exposure until I went to the MBA school, and that's not the school giving you the exposure, but it's your classmates, all these like
People.
fantastic people that you get to know and network with, who really expand your mind on what's possible. And I think that's really why I enjoyed it.
That's interesting because the reason I ask you specifically is because I know a bunch of people who do it like 20 years into their career, or
Mm.
like 15 years into their career. Uh, but I think just I don't know what the word is. Maybe the competitive advantage of having that exposure sooner rather than later
Yeah.
might actually be a good thing. You like you said, you have the network, you have I would say the open-minded thinking and also relatability maybe of decisions that are being imposed on you, right?
Yeah, I do think
And
that it shifted the way that I thought about healthcare, in a way that probably it would have been very different if I had gone and did an MBA like now or 5 years from now or something like that. I think most people who end up getting it, 15 or 20 years into their career, what they're really looking to do is they're either looking to use it to accent what they've already done. So there was a lot of people in our class who, were in these very high level roles within medicine, but they wanted to add that to their credentials because it's going to help them get to the next level. So it's very like methodical and strategic way of thinking about it. Or there was like a definitive shift that they wanted to do. For me, I had no idea what I was getting into, to be honest, or what I really wanted to do. I wasn't as young as some of the other people who just like go from school to school, because I'd had some residency and some fellowship and some other training. But at the same time, it allowed me to just like be very open-minded early on in the career and end up not taking, I guess, what is more of a traditional path or an expected path.
That's that's amazing. So would it be fair to say that you would not be in informatics today had you not done the MBA?
I think that's fair to say. I mean, who knows? But yeah,
Oh
that
wow. So it did, yeah, but it
yeah,
was transformational then in that sense, right? That
yeah,
really
yeah.
interesting. Nice. So so Melissa, what do you just going from say neuroradiology to informatics to AI, uh, how have you seen the world kind of progress over the last uh, you know 4 to 6 years of AI? What are your high level thoughts on that from a radiology perspective, of course?
I mean, radiology has always been a technology forward type of has always been a very technology forward type of a field. And so, the last 3 or 4 or 5 years have been really exciting around what is the potential for these technologies. I think early on it was a little bit of trepidation because we were like, well, we don't really understand what they do. And to be honest, we still don't completely understand what they do. But I think, there's been a shift away from seeing AI as more of a threat and seeing it more as like an adjunct to what it can do to help me. And so when I talk to people about how I think that AI is going to evolve, I know that we focus a lot on like diagnostic algorithms. This can detect this can see this, detect a head bleed, detect a PE, all that kind of stuff. I think that's useful. But the stuff that we get really excited about are the things that make us a bit more efficient over time. So can this thing measure this pulmonary nodule over and over and over again so I don't have to do it anymore? Or this cyst? Or can it standardize the measurement? Because all of the radiologists, we measure differently because we're humans. So we're gonna be slightly different
Hmm.
every time I make a measurement. It's like little things like that they aren't sexy in the imaging space, but they're really useful to us. And those are the types of AI that I'd like to see gain a lot more traction over time. And so I'm hoping that the space will evolve in that direction. So I think we've moved away from trepidation to more like, how can this really help me? How can this make me a better radiologist?
Yeah, funny thing is, Melissa, so I'm at Sim, as you know, right now. That's why I have like this thing on. Uh, and yesterday I met a company that is building a product for study description identification by looking at MR images, right? Essentially, like there is this whole problem, right? Nobody sticks to the same study description or series description or and
Mhm.
that across say a fleet of MRs, right? Let's say you have 50 MR machines or something. Yeah, every place, especially in the private sector, it's more prevalent, right? Where there's multiple agencies that have been acquired or have come together. So these guys have built such a well seemingly simple tool that can tell you, okay, this is spine T2 SAG, right? And
Mm,
kind of
yeah.
correlates it to a specific code. And by looking at the actual image, um, And I found that to be pretty cool from a business perspective as well, right? Like it's so difficult for uh, large radiology players to today even give a reliable study count of
Mhm.
you know what their standard MR uh, protocol is or is not. So
Yeah.
so it's pretty that was pretty cool.
I'd
So
like to I'd like to talk to them because the one of the my biggest like thing that irks me is that. And so whenever we're reading a study that comes off of any of the scanners in our fleet, and like you said, they're all named differently, they're all described differently. We have hanging protocols in our system, and all of our hanging protocols never work. And they never work because
yeah,
nothing's named the same way, and it's hard to maintain that. But if you had a tool like that that said, hey, I know this is an axial head CT, I'll put it in that slot. I know this is a coronal head CT, I'll put it in this slot. All of this dragging and dropping that I'm doing every day goes away. And that, like stuff like that, I'm really excited about. So I'd like to talk to them.
and it's so well it's so simple on the surface, right? From at least from a utility perspective, right? Like
Right.
and no matter what you do, like it's just one of those problems that is unsolved. I'm interesting that even a place like Yale would face that issue, right? Which means that the entire world probably faces that challenge.
Yeah.
Um,
Yeah. Ask anybody.
Melissa, one thing, just doing a little bit of uh, hand wavy future gazing. Um, I'm not sure if you've seen, but there is this whole move of uh, making it easier to build AI to the extent that there are companies out there that are now maybe not very aggressively, but suggesting that there is a potential future state where uh, hospitals or imaging companies build their own AI, and then they take it one step further to say that, hey, maybe there is a future state where radiologists build their own AI, as opposed to like the hundreds of companies that are today building AI. Or maybe there is a middle ground where these hundreds of companies, instead of building final AI solutions, build like an intermediary product that can then be Melissa's personal AI agent kind of thing. So, do you have any opinion on uh, how you see this pan out, over the next 5, 7 years, say, as technology becomes more robust?
Yeah, I mean, I don't want to be predictive because I feel like all of our predictions have failed so far when it comes to AI, but um I think there's going to be a combination of everything. So you have institutions that are good at building their own AI. And I think that those institutions will continue to do that. And then you have institutions that kind of can do it, but kind of cannot, and they need vendor help. And I think
Mm.
that we kind of fit into that. We have some solutions that we're able to build, but a lot of it we need vendors to help us with putting some of that together. And then there are practices where they're just not going to have the interest in wanting to do that. And so being able to, go out and purchase something that you need is going to be maintained. So I really think that it's going to be a grade is what ends up happening from the way that I can see it being built right now. But if there's some capacity to make it so that you don't need a computer science background in order to build these AI tools,
Mm.
I think that will open the door to allowing people to start to either tweak or modify what's already out there, which I think is more realistic than building up from the ground internally for a lot of people. Mostly you're going to see
No, I
people
think
build if they have a lot of funds or they have a big research team.
hmm, because Melissa, it's so interesting. Uh, all of the big, you know, hyperscalers like AWS, Azure, Google are all building, these so-called low-code training platforms, or even say no-code training platforms.
Mhm.
And CARPL, from our standpoint, we're always stuck in this conundrum that how deep do we integrate with those guys, right? Like tomorrow, if say someone from Yale reaches out to us and says, "Hey, I have 1,000 mammograms and I want to now build my own AI. Like, uh, it is possible. It is very much possible today to do that. Like, it's technically, of course, regulation and FDA is a separate 1 hour conversation. But I think, like, from a tech perspective, so we're often stuck in this conundrum as to, how deep do we build. So I guess we'll find out.
Yeah. What do you think? What is your thought on that?
No, we see, from our standpoint, we want to be flexible, right? We want to play out all futures,
Mhm.
because when we go live at an institution, from our standpoint, we are going live forever. So
Mhm.
if there is a point in time where there is going to be some kind of need to for a radiologist to build their own AI, we don't want to be caught off guard and then have to say that, hey, we can't provide this service. Or so flexibility is a core pillar for
Yeah,
us. So yeah, so we'll see.
sure. I think it's
Uh,
important.
as we No, go ahead, please. Sorry.
Oh, no, I was just saying, I think that's important to be flexible because I do think it'll be easier to build over time and you will see more people building in-house than not. So,
Yeah. Let's see. Hopefully it'll all be through us. So as we draw to the close, Melissa, you know, there's a lot of this is going to go on to YouTube, and already there's a lot of people listening in. If there's like a 22-year-old, either potential med student or engineer, or anybody who's thinking about entering uh, the domain of healthcare informatics, healthcare AI, uh, what would be your guiding words to them? Like, what should they look out for, uh, and why should they do this?
yeah, I think healthcare is an exciting place to be when it comes to technology because we historically have been very behind other fields like banking or places like that when it comes to incorporating technology into our workflows. But it is something that the door is now open to. And so I'm excited about what that future is going to bring. What the advice that I would give young people is to remember that healthcare is complicated. It's not a simple process at all. There are large systems that are involved in almost every single step of the way, from the decision making piece, from the building piece, from the implementation piece, from the maintenance piece. And so a lot of us get frustrated about the pace of how things move in healthcare, but it's because we have so many regulations and frameworks around the way that we practice that makes it very complicated. So I would say pack your patience if you're going into healthcare AI. And then don't focus just on the technology, but also focus on the actual people and the process of what's going of where you are within the system that you're working in. Because most of the time we're trying to use technology to fix something, but a lot of times it's actually a systems process that is broken. And if we lay technology on top of a broken process, we're just going to have an even more broken process that's more efficient at being broken. So being able to understand like the workflow is very important when it comes to health AI as well.
Yeah, I think the one line summary could be that spend time in that workflow, right?
Mhm.
Uh, Maybe that's something that we see not a lot of people do. There is one last question, and then we'll close, Melissa. We try to keep this half an hour very sacrosanct. There's one question, from somebody who doesn't want us to know who they are. How should ongoing education and training for radiologists be structured to effectively incorporate AI in daily practice? Yeah, what's the role of training?
Yeah, I mean, I think that all of this is evolving as well because AI is so new. The question is like, how do we start to make sure that we as practicing radiologists can keep on top of these? And I think it's going to be very similar to other ways that we keep on top of evolving technology, like understanding new MR techniques, understanding new CT techniques, things like that. There's a lot of continuing medical education out there about this, and I think that's very useful. I think having journals available to you There's a ton of literature, and just perusing that is very effective for like self-guided education. If we're talking about education for trainees, I do think that a lot of our residencies have started to think about that in a more formalized way. We at Yale have a mini fellowship in informatics. So when you're in your 4th year, you come on as a mini fellow and you get immersed in our team. And so that really allows some education. And one of our mini fellows actually got SIP certified coming out of that. So it's going to be a variety of things, but those are the ways that we're trying to do it.
Oh, awesome. We're getting a couple of questions in, but guys, we'll close. What we will do, and Melissa, I'm not sure if you know, we have the Unboxing AI LinkedIn group where we'll post the questions that have come in that we are not able to answer, and we can reply there. I'll coordinate with you offline and try to figure that out. But wow, we've got 3 questions coming in. Or if you have a couple of minutes, can we run through them?
Yeah, I can read through a couple of them. I see one about radiologists say make the AI fit within the existing workflow, but is a real value in disrupting or reimagining workflows. There is a lot of value in that. There are some workflows that do need to be disrupted and that need to be reimagined. But we have to remember that we're taking care of patients. And so there's lives on the line whenever we do that. And so a lot of physicians are very reticent to change the way that they operate because they know that this is a safe way of operating. And so whenever we try to add that disruption, we just have to be very mindful about it. And to not think, sometimes disruption isn't like a wham bam thing. It's not like this happens and boom, we've disrupted. Sometimes it's a very slow process where you're slowly implementing things and you're seeing the way that workflow is now evolving because of that. So I would say yes, and think about how disruption can actually be a long-term strategy rather than a short-term strategy.
Nice.
How do you?
And then I think we could do the last one.
Yeah, up to you.
No, go ahead.
Okay.
You run this. Yeah.
So how do you keep yourself updated about the latest technology advances? Could you mention any specific resources? So I read like Clinical Imaging, which is a journal, has a lot of this in it. JCR has a lot of this in it. Radiology's been publishing. There's a Radiology AI journal that's been publishing. Academic Radiology has done. Those are some of the journals that I typically read. I also just will look things up if I hear something that I don't know. I'll do a deep dive on like just understanding it. I recently read a board review book for clinical imaging because I am thinking about taking the kind of non-fellowship pathway for that before it closes. So so those are the types of resources that I personally have been using. And then I see a question on my passion about imaging. Thank you so much. I love my job. In your opinion, what type of imaging do you think needs to be discontinued from diagnostics? That's a hard question. Discontinued from diagnostics. I don't know.
I would love to hear this.
Yeah. I can't give you an answer on that. I don't know. But I can say that like
DEXA scanning. I don't know, DEXA scanning.
Maybe. I don't do too much DEXA. I was never a fan of the rectal barium enema, so maybe that can go away. Yeah, that can go away. But I think as we evolve,
that's a good one.
Yeah, what's useful or not. But when we talk about like X-ray, CT, MR, I think all of it has its value. But I think there's some certain procedures that have evolved over time that we don't need anymore.
Nice.
So, yeah.
No, that's brilliant. No, we'll sign off, but thank you so much, Melissa. It's a pleasure always to speak with you, and thank you for doing this. And yeah, hope to see you soon.
All right, thank you. I appreciate the invite.
Thank you. And